Could the most popular weight loss drug double as a treatment for alcoholism? There's a brand new clinical trial studying just this and whether Ozempic and drugs like it could be the first real medication to cure alcoholism. There have already been reports that people using Ozempic and Mounjaro and Wegovy are losing their desire to drink. But it's all anecdotal right now. It would be a game changer if it turns out to be real for those who are desperately trying to break the chains of alcohol addiction. Here's the science. Drugs like Ozempic and Wegovy are used to treat type 2 diabetes and obesity. The medicine mimics behaviors of the natural hormone GLP-1. That hormone controls our appetite and it regulates our blood sugar. An unintended consequence of taking these drugs appears to be that people on Ozempic are drinking less alcohol. They say their urge to drink alcohol has been dramatically reduced. Well, joining us now with more on all of this is Pat Awesome, a Vice President of Content Development with the Partnership to End Addiction, and Dr. James Besante, an addiction specialist and Chief Medical Officer at Sante Fe Recovery Center in New Mexico. Great to have both of you with us. So, Pat, so far, this is just anecdotal from people who are overweight and trying to lose weight. The drug for them reduced binge drinking by 50%, which is high. This study that is starting now is the first study that tests people who are of normal weight and who do actually suffer from alcoholism.
So it's a great study. There actually was one other one that was completed in 2024 that asked people who were not interested in getting treatment for alcohol use to try the drug, and they were given it for 9 weeks. And what they found at the end is while it didn't decrease the number of days that they drank, it decreased the number of drinks that they had when they were drinking, and it really helped with cravings, as well as, on a side note, getting them to smoke fewer cigarettes. So all of that was really great. The newer study is STAR. So it is a study on reducing alcohol use for people who are of normal body weight, 18 years old. They have to go to Baltimore to a NIDA facility, National Institute of Drug Abuse, for, I think it's up to 5 months. It's every week for 5 months. Mm-hmm. They will either get a placebo, which is a saline shot, or they'll get the actual medication. And they're going to look at things like, is the medication tolerable? What dosage level do you need? And things like that.
Listen, if this doctor works, this new study, the difference is this new study is testing people who say they actually have problems with alcohol, as opposed to people who are trying to lose weight or, anything else. They're gonna test how it affects their cravings. They're literally going to put an alcoholic drink in front of them and let them smell it and see if they can easily resist it.
Yes, I think this is exciting. We're learning a lot of new exciting things in addiction medicine. Medications originally designed for weight loss and diabetes, like semaglutide, also known as Ozempic, are showing promise in treating addiction. Not just alcohol, as mentioned, tobacco addiction is also being shown to be reduced when people are on these medications. So it's exciting. The data is still early. I want to be clear about that. These treatments are still considered experimental for addiction. We don't yet have long-term safety or efficacy data, and they're not covered by insurance when they're used for this purpose. And that's really important. It makes them inaccessible for many of the patients I see. Mm-hmm. So if you're someone who's thinking about changing your relationship with a drug like alcohol, it's important to know that there are proven safe options out there. There's FDA-approved medications like naltrexone, acamprosate, that are supported by years of research that are typically covered by insurance. So while this, new randomized controlled trial is very exciting for me, I'm familiar with the data that already exists for Ozempic, there's already evidence-based help out there that's available, and it works very well.
Right, but naltrexone, this would actually, I don't need to tell you if you're in the addiction recovery field. Full disclosure, I work with Pat. I'm also on the board of directors for the Partnership to End Addiction. There are a lot of people who are desperate for that magic pill, and who think that, and with this new study actually studying how it works on people with alcoholism, not just people who are like, oh, maybe I want to drink less. I don't know. That's not the way an alcoholic talks. They're driven to drink, sometimes against their own will, it almost seems. So it could be a game changer if these drugs happen to work well with this disease that afflicts millions of people.
Absolutely. You're exactly right. We need more tools in our tool belt to treat addiction. Alcohol, tobacco, they're leading causes of preventable death in the United States of America. So any movement on these two chronic diseases is enormous for public health, for the lives and well-being of so many people affected by them. I always caution people against the idea of a magic pill. I'm also a board certified internal medicine doctor, and every chronic disease I manage, like alcohol use disorder, folks are looking for a magic pill. This is a really complex disease that affects different people differently. So while I always look for a medication that's going to be helpful in helping people change their relationship with a drug like alcohol, rarely is there a magic pill or one medication that's going to solve this person's issue if they have problem use of a substance, but it is a very helpful tool in their tool belt, oftentimes coupled with behavioral health interventions and other evidence-based treatments that work very well.
Pat, we don't know the long-term effects. You know, this is the same danger for folks who are using these drugs to lose weight. Here's the problem. We don't know the long-term effects of these drugs because they're brand new. We also know they're very expensive. A lot of people, you know, have the funds to pay for that, but a lot of people don't. And you have to take them for the rest of your life. The reports are the minute you stop taking the drug, you gain all the weight back. So that raises the question, would that mean the minute I stop taking Ozempic, would a person want to drink alcohol again?
Right. I think those are things that we have to investigate. So all the things you're talking about, what's the safety profile? What kind of dosing levels do we need for different people? What age can you use these medications? For how long? So all those different things are going to come into play as we continue to do these trials. I think one of the unfortunate things about some of the trials is they're pretty short. The first one I mentioned was only 9 weeks. So it's really difficult to ascertain, you know, what's going to happen longer term.
And 10 seconds, doctor. We know addiction is a complicated thing. This would not target the underlying reason why some people are driven to drink in an incredibly destructive way.
Exactly right. Many of my patients use alcohol to manage mood symptoms. For many of them, it's the best tool they have in their toolbox to manage trauma. So again, this medication, this is exciting. I'm always excited to hear about new therapeutics. But again, it's one piece of the puzzle when we talk about addiction.
All right, Pat, awesome. Dr. James Besante, great to have you both on. Thank you so much.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.